A massive drought across East Africa is creating one of the worst refugee crises seen in years. In fact, the drought in areas of Somalia is the worst in some 60 years. This is leading to massive famine, as you can imagine, and has sent hundreds of thousands of people fleeing across the border into Kenya to somewhat of a safe haven, to refugee camps there, where there is a rush to send them food and a rush to save their lives. But the country they are fleeing is still an incredibly dangerous place. Warlords are fighting for control. And if this story sounds somewhat familiar, it should, because it's a situation very similar to the early 90s when the U.S. sent both aid and troops to Somalia. Even for a continent sadly accustomed to famine and misfortune, the situation in eastern Africa is dire. These are some of the thousands fleeing Somalia on foot. They leave behind a nation plagued by malnutrition, disease, and poverty. Many of the refugees find their way to the Dadaab camp in Kenya, the world's largest refugee camp, housing some 380,000, nearly 4 times its intended capacity.
Close to 11 million children and families in East Africa are suffering from the effects of the worst drought in 60 years.
Relief organizations are doing their best to bring attention to the plight of these refugees. Meantime, in Somalia, the first shipment of food was delivered Wednesday to Mogadishu, the first since the official declaration of a famine just over a week ago. But the UN says it cannot get aid to more than 2 million people who are unable to flee the country's south, territories controlled by rebels linked to al-Qaeda and where some of the most desperate can be found. Joining us now from Kenya's Dadaab refugee camp is UNICEF spokesman Christopher Tidey. The pictures are pretty tough to look at. Give us an idea, though, Chris, what is it like for you on the ground there as you walk through these camps?
Well, I would say it's pretty difficult. There's no question about that. The hardest thing for me really is going into to the camps and seeing the children in particular and what they're going through, particularly the new arrivals. A lot of the children are battling malnutrition, and to see that up close, it's tough. These kids have been through a lot. There's no question about that, and they're gonna need a lot of time and help to recover.
90 children a month, I'm told, die of malnutrition. You have so many people streaming into these camps. 1,300 a day was one estimate. Is there ever a fear that you're going to get to the point where you would have to turn someone away?
No, we're definitely not at that point, and I don't expect that we ever will be. The fact of the matter is that these camps have been here for, going on 2 decades, so we do have the infrastructure here to provide the medical services that these children need. What we need to do now, given the rate of the influx, is we need to scale up our efforts. So that includes procuring more vaccines and getting help from international donors to make sure that we have the supplies we need to give them the care.
Given the drought, given the famine conditions that we see, especially across the border, what is your biggest challenge? Is it getting those medical supplies? Is it getting enough food, enough water?
I think that right now our biggest challenge, particularly given UNICEF's focus on children, is to make sure that we don't have an outbreak of disease. Obviously, children that are suffering from malnutrition, they tend to have compromised immune systems, and that's just, ripe ground for an outbreak of an opportunistic disease like measles or polio or pneumonia or something like that. So that's an immediate big challenge. So what we're doing is we've just launched an emergency vaccination campaign for children in the host communities and also in the camps to get them vaccinated against measles and polio as quickly as possible.
And what happens to these children? The camps have been there, as you mentioned, for 2 decades. Are these kids who will ultimately spend their life in a refugee camp, or will they move on to somewhere else?
Well, I think, as you said, a lot of children were born here and have been here for a number of years. We have new ones coming in. It's part of an ongoing process in terms of being registered as a refugee and spending time in the camp and whether or not they move on. Ultimately, what we try to do is provide them with the services that they need here. So we're supporting schools in the camps so that we're helping kids to get an education. We're providing them with medical services and also the opportunity to engage in recreational activities. So for as long as they're here, we are working to make sure that they have what they need to live quality lives.
Well, they're lucky that you are there with them. Chris Tidey, thanks for your time this morning.
Thanks so much for having me.
And just a note, we're going to bring you a closer look at the life in those camps and at some of those children. We're actually heading to Africa to cover the crisis next week.